plastic surgery, and it's hump day with Dr. Alex Earle. This is the time I'm going to spend with you guys to talk about plastic surgery topics and of course answer all of your questions, okay? So today we got a very, very important topic. It's not too long a topic, so we're going to go over this. But if you have your questions, have them ready, because once we're done talking about this, I'm going to be happy to answer any and all questions that you may have. And once again, these questions can be about any procedure. Remember, I do a lot of body contouring, so a lot of breast procedures, tummy tucks, liposuction, BBL. But of course, I know about all plastic surgery. So if you want to ask me a question about rhinoplasty, facelifts, etc., I'll be happy to answer that as well. Okay. So today we're going to talk about hydration. Okay, hydration. Okay. Now this is a very, very important topic, and I think it's often not given the importance that it needs. Especially by the patients a lot of the times, okay? But the fact is that we are mostly water. I mean, if we take our body as a whole, we're something like 60 to 70% water, all right? And if you're talking about your brain is about 75% water, okay? And your blood is 85 to 90% water, okay? So water is extremely, extremely important. So not is it just important kind of just in general for your general health, but it's even more important when we're talking about surgery, okay? So one of the things is that, one of the things that we kind of always talk about is how to get ready for surgery, okay? And of course, along that, you're gonna have many, instructions on how to best prepare for surgery. But one of the things that we wanna emphasize is to make sure that you come into surgery, okay, already hydrated, okay? Especially because right before surgery, we're going to ask you to not eat and drink anything for 8 hours. All right, so that in and of itself is going to kind of put you a little bit behind. So if you're already starting behind and then you go 8 hours without eating or drinking, then you're really going to be behind. And then we're playing catch up the whole way. We're playing catch up during the operation. We're playing catch up after surgery, okay? And we don't want to be there. So I would say starting, if you're not doing this every day, certainly starting about 2 weeks, at the very least 1 week before surgery, you start drinking a gallon of water a day, okay? And that's gonna help you come into surgery with what I like to call a full tank, all right? And you always wanna be coming into surgery with a full tank. It's gonna make it a lot easier during surgery for our anesthesiologist, okay? She's gonna have to do less work, and she loves to do less work, all right? So not as many IVs, not as many medications, not as much support for the patient because you're completely vascularized, okay, and your tank is full right before surgery. In terms of just in general, hydration helps. Of course, it helps with removing toxins from your system. It helps with your skin, which is incredibly important, right? We're always like talking about, oh, what's the quality of the skin? Are you gonna have skin laxity? Is the skin gonna look uneven because it didn't retract well? All right, well, hydration has a lot to do with that. So if you're having lipo-BBL and you may have a little bit of skin laxity, make sure you come into surgery fully hydrated. That's going to help the skin retract a lot better as well, okay? But what happens when you get dehydrated, right? So while, of course, being hydrated before surgery is important, it's like 10 times more important after surgery, all right? Because if you don't do this, if you become dehydrated, then you're going to have slower wound healing, okay? Slower healing in general. But more importantly, you're going to be weak, okay? You're going to start feeling weak. And when you're weak, guess what? You don't want to get up and walk around. And when you don't get up and walk around, that's an increased risk for blood clots, right? We did a whole live on clots. So when you're weak, you're not walking, so then you have increased risk of clots. Okay. The other thing is when you're dehydrated, the blood is not flowing as quickly or as well as it should. It's more sluggish, and when you have sluggish blood, then you have an increased risk of clots. Okay, so very, very important. You want to be hydrated. You don't want to be weak. You want that blood flow to be moving adequately to prevent any potential clots. Okay. The other thing is in terms of your vitals, you typically have an elevated heart rate. Okay. In the 120s, 130s, 140s, and your blood pressure is going to be on the lower side, right? So you're gonna have elevated heart rate, lower blood pressure. You may start to feel lightheaded, especially when you change positions, right? So when you go from laying to standing, if you do that too quickly and you're not fully hydrated, the blood pressure then tends to drop, and then you start feeling like very, very lightheaded. Sometimes you start to kind of black out, and if you're very, very dehydrated, that can lead to fainting, okay? So you go from laying to standing up, you're not hydrating well, the blood flows all the way down, it leaves the brain basically, and then you black out. And then once, what do you have to do? We have to like lay the patient down, allow everything to kind of regulate, and then the patient, comes back. All right, so what is, I think the answer is obvious, but let's go ahead and ask it. What is the number one reason to end up in the ER after a lipo 360 or BBL? Let's see, it's the answers. Anyone just yelling it out there? All right.
Nothing yet.
Not really. Okay.
We got somebody saying puncture.
No.
Infection.
No.
Clotting.
No, we're talking about it right here. So the number one reason to end up in the ER after lipo 360 and BBL is dehydration. Number one, by far. That's the most common reason for going to the ER. Why? What happens? You don't hydrate well, okay? Next thing you know, you try to get up, you faint, you pass out. Okay, you try to get up again, you faint, you pass out, and your caregivers start getting really, really worried, and they call 911, and they come pick you up, take you to the ER. Then they'll do everything. Yeah, you're like, okay, well, we got to do the CAT scans. There's no blood clot, there's no puncture, there's no perforation. The hemoglobin level is above 7. We usually don't transfuse unless it's below 7 or below. And the only thing that's going on is dehydration. Number one reason to go to the ER by far. That's how incredibly important this is. Okay? Because when you're hydrated, this increases healing, increases blood flow, decreases chances of clots. You're feeling stronger, right? You're feeling stronger, and you're up, you're moving around, you're walking, you're doing everything you need to do in order to recover well. Okay? And on top of that, you're able to filter out all the meds, right? So you have good blood flow. That means that the kidneys are getting adequate blood supply. That means that they're doing their job. It means that the liver is getting adequate blood supply. It's doing its job. Those are the two main filters in the body. And so they're able to then filter out all the kind of the medications and the anesthetic gases that we use for your general anesthesia, which also helps in recovering, more quickly and feeling better sooner. It also helps in decreasing nausea. Actually, I didn't write that down, but that's another good one there. When you're dehydrated, your chances of post-operative nausea are way higher. Okay, so one of the best things, so it's not just about medications. Yeah, we can give you the patch or the Zofran is what we use typically for nausea, but more importantly than that, you got to get hydrated. You got to get hydrated, extremely important, okay? So these are all the reasons, all right? So what is the goal? The goal is to drink 1 gallon of fluid per day. Mostly water, some Gatorade, some pineapple juice can help as well. But you want to do 1 gallon a day. If you're using the metric system, that's pretty close to 4 liters. All right, so a gallon or about 4 liters a day. And you should start at least, like I said, a week before surgery, preferably 2 weeks before surgery, so you can come in with that full tank. All right, and then you gotta, once you have surgery, you gotta try to hit that goal that very same day. Now I get it. Now surgery day might be tough, right? You went in 8 hours without eating or drinking. Then you had your surgery, you had recovery and everything else. So it might be tough to get a gallon that day. Do the best that you can. But certainly by post-op day 1, you're back at it, a gallon a day. And then a gallon or 4 liters is quite a lot. So if you're not actively thinking about it, if you're not jotting down exactly how much you're drinking, then you're not going to meet that goal. And without even thinking about it, you're going to get dehydrated and you're going to start having symptoms, okay? So what you should do, a lot of times I tell my patients to get one of these gallon jugs, fill that up with water, okay? And by the end of the day, that has to be empty, all right? And that's your goal every single day, all right? From about 2 weeks before surgery to at least 2 weeks after surgery, okay? And I said, and the other thing that it's gonna help with is like we were just talking about is your skin, okay? So in order for your skin to like really have that nice what we call elasticity, that ability to bounce back and retract and look nice and smooth, hydration is incredibly important, okay? So there's many lymphatic massage therapists out there, post-lipo massage therapists. They're gonna tell you the exact same thing, but from their point of view. They're gonna say that your skin is gonna do a lot better, you're gonna recover a lot quicker if you drink 1 to 2 gallons of water or liquid a day, all right? So yeah, go ahead and ask them. You talk to your massage therapist, ask them about this, and they'll tell you the exact same thing, but from their point of view. They like it because the skin does better, you recover better, you bounce back, and you end up with a lot smoother, contours. Okay. All right.
All right, we got a few questions.
Now that everyone understands the importance of this, I'm happy to answer questions about this or any other classes.
Yes. So first, hi doctor, I have surgery with you Monday, and I just would like to know how much water specifically should I drink? You said a gallon at post-op. How much should I drink before I come in?
So if you can do a gallon before, that's great. So for a couple of reasons. One is because you're definitely going to be very well hydrated. Your tank is going to be full. Plus, you already start getting into that routine, right? We're humans, we're very habitual type creatures, right? So once you get into a routine, it's a lot easier to kind of do things kind of automatically or kind of semi-automatically there. But if you've never done it and then the first thing you try to do is do this right after surgery, it's going to be a lot tougher for you. Okay.
I know lipo sometimes results in fibrosis.
Yeah.
Does staying hydrated help prevent this?
Definitely. So so what are the reasons for fibrosis? So a lot of it has to do with the inflammation, okay, under the skin, causing increased kind of scar-like tissue, okay? And that skin also does not, it's not supple, it's not soft, it doesn't have that elasticity, and it kind of folds upon itself. The chances of having inflammation and scar-like tissue underneath are higher. Okay, so definitely hydration is going to help minimize the risk of fibrosis along with your post-op lymphatic massage. All right.
Thank you.
Yeah. Overall, what is this the most important for? This is most important for lipo 360 and BBL. Okay, because those are the surgeries where you have the biggest what we call fluid shifts, fluid coming in and out. Okay. And your body having more trouble kind of regulating those fluid shifts, especially if it's not well hydrated. So certainly extremely important for lipo 360 and BBL. I mean, do you have to drink a gallon a day for a 30-minute breast dog with like minimal to no blood loss? Okay, no, it's not as important for that, right? But lipo 360 BBL, number one, and then number two is any kind of bigger surgery like a mommy makeover or a trifecta or anything like that.
Okay, kind of a follow-up on that question. Can you get rid of the fibrosis in a round two if you happen to get fibrosis?
You can certainly try, right? So it's not easy. I'm not gonna say it's easy. A lot of times it's very challenging, okay? But you can do it. So if it's been a year post-op, right, and you've tried everything else, you tried your massages, your wood therapy, your other non-invasive treatments like ultrasound, radio frequency, and stuff like that, and you still have fibrosis after a year, then at that point in time, it's unlikely that non-surgical treatments are going to take care of it. So the next best step is to go back into surgery to do basically a round two liposuction to try to kind of break up that fibrous tissue, smooth things out, and then start all over again.
Thank you. Getting surgery next month. Very excited.
All right.
Is watermelon juice good as well as for before and after?
So watermelon juice, honestly, no strong opinion either way. I mean, I think it's fine. Like I said, the bulk of this gallon should be just straight up water. Okay, so say if you're doing a gallon or 4 liters, perhaps like 3 of those liters should be water, and the last liter can be, watermelon juice or pineapple juice or Gatorade or something like that.
How many massages do you recommend? BBL, lipo.
Right, so for lipo 360 BBL, we're now recommending a minimum of 20 massages, okay? In order to truly optimize your results. Maybe, a couple of years ago I was saying 10, I found that 10 is just not enough. 10 is not enough, so we're recommending a minimum of 20. The first 7 are daily. The next 7 are 2 a week, so you get about number 14 or so. And then the next 6 or 7 would be weekly, right? So we did 7, it'd be actually 21. So, but that's an easy way to think about it. So 21 massages, first 7 daily, second 7 2 a week, third 7 weekly. Does that make sense?
To me, it does.
A lot of numbers. All right.
Me, because I've heard you say it a lot. But
That's right.
let's see. Oh, hi. How long does a Lipro 360 BBL takes? I've heard you say an hour and a half. How come some surgeons take 4 hours? What's the difference?
It's probably experience. I've done 3,000 of these, right? I've done a ton. So what's the difference? I think a lot has to do with experience and of course the efficiency of the surgeon and things like that. So I would say that our average time is an hour and a half to 2. Now, of course, if you have maybe a bigger patient, higher BMI, or if you're doing a lot of add-ons, like you're doing lipo arms and body type and face type and all this stuff, it could potentially go longer. But if you're doing just straight up, I would say the average is about an hour and a half to 2. Now, it wasn't always this way, right? When 4 years ago, it did take me 3 hours or 4 hours maybe. It just, as a surgeon, keeps kind of honing their skills, doing more and more of those procedures, they become more and more efficient. And so when you get to a certain level of expertise, you're going to be cutting down the time to achieve the same or even better results.
Thank you. How soon after surgery is it safe to start meds that are phentermine based?
Phentermine based.
Phentermine based.
Yeah, that's right. Okay. So phentermine is actually an amphetamine based. Okay. You don't want to do that till at least 30 days after surgery. All right. Why? Because all amphetamines, whether it's in the form of a true amphetamine, whether it's in the form of an ADHD drug such as Ritalin, or phentermine, which they use for weight loss, all of those can affect the heart. And when you combine that with the medications that we need to give you for your general anesthesia, there's a potential chance for issues with dysrhythmia, so the rhythm of the heart, and potential heart attack as well. Okay, so you want to, very, very important to stop that 30 days before surgery, from 30 days before surgery to 30 days after surgery.
Thank you.
All right.
Let's see. Do you offer Sculptra for the butt area if someone does not want a BBL?
So we do offer Sculptra. We have that here. I wouldn't really call it a BBL substitute, okay? In the sense that it's more for like a defined smaller area, right? It's very, very tough to do like a full buttock kind of volume or hip volume increase with Sculptra. That would take multiple syringes. It would become even more expensive than your regular BBL because these syringes are very expensive. And the results are not going to be, they're going to be way more subtle. And it typically takes 3 sessions. And then after the 3 sessions, the results will last about 2 years. So it's not permanent, okay? So what is Sculptra good for? Sculptra is good for, let's say you had a BBL and you have this one small area that you just want to fill out a bit more, okay? And you don't want to go through like another anesthetic and all that stuff. Okay, that's a good use of Sculptra. So it's really to fill out smaller defects without having to go back to the OR.
Can you combine a breast lift with liposuction and possibly ab etching?
You can for the right candidate. Okay, so remember, here in Florida, we're limited to how much fat we can remove at the time of a breast lift, which is only 1,000 cc's of supernatant fat. Okay, so if you're a little bit on the lower BMI patient, okay, and 1,000 cc's is going to make a significant difference for you, and that's typically the same patients that are candidates for ab etching, then yes, we can combine that. So we call that the Miami makeover. You may have heard that term from us before, but that's typically a breast procedure with lipo 180 of the abdomen and flanks, plus minus ab etching or HD lipo.
Thank you. Is it more difficult to work with skinny patients, especially in removing fat?
So for lipo 360 and BBL, sometimes it can be a little bit more challenging. So it's a little bit of the opposite of what many patients think. So and it's not because you're removing more fat or anything like that. So most patients will think like a bigger patient takes more work, it takes more time than a smaller patient, but that's not necessarily true. So for the smaller patient, we have to find adequate amount of fat, right? So sometimes we've got to go to different areas, including like the arms and the thighs and things like that. And B, we got to be really, really careful that we don't create contour abnormality. Okay, then that can lead to, to basically an uneven appearance and also increased risk of fibrosis and also increased risk of what we call lipoburns or, basically trauma to the skin. So you have to be really, really careful with the thin patients or the thinner patients. And there is a lower kind of threshold BMI for a BBL, right? I typically don't do anyone but with a BMI of 21 or below. You have to be higher than 21 for a BBL. So yes, you have to be very, very careful with the lower BMI patients, yes.
How does the internal bra work? And do you offer that with your lifts?
Yeah, so what is the internal bra? It's a mesh that you put inside the breast, typically in the area of the pocket where the implant is, okay? And this mesh, you tack it down to the chest wall and you form a sling and it helps hold the implant up and therefore there's less effects of gravity. And so that way there's less chance of the skin stretching and bottoming out. Do I do this as kind of a primary procedure? I typically don't. So if this is the first time you're ever getting a breast lift with implant, then I typically don't recommend the mesh because most people are not going to need it, okay? But there are some that will. About 25, maybe 20% of people might come back. If you're going back for like your second round breast lift because you bottomed out, so it's a secondary case, a revision type of case, or a reconstruction type of case, then in those cases, then I do recommend the mesh to give some added support.
What's the largest implant that you have?
The largest implant is 800 cc's and we very rarely use that, okay? So silicone implants don't tend to come above 800 cc's. Now, if you have saline implants, sometimes you can fill them up higher to like 1,000 or 1,200 cc's. Again, I don't recommend that. I would say that our average implant size that we use here is somewhere around 375 to 400 cc's, and that's typically adequate for, I would say, over 90% of our patients.
Thank you. Why do some doctors offer drainless tummy tucks? What are the benefits versus drains?
Yeah. All right. So how can you do? So what do you have to do differently to make it a drainless tummy tuck? Okay. So what you have to do is you have to put multiple little stitches inside, basically bringing the skin back down to the fascia, which is the layer that covers the muscle, right? Because one way or another, you have to eliminate that dead space. So you can either eliminate with stitches or you eliminate it with drains, okay? Now, the proponents of drainless tummy tucks say that then the patient doesn't have to deal with the drains and it's basically a comfort thing for the patient, okay? Now, the downsides and part of the reason why I don't do a drainless tummy tuck, okay, there's a few potential downsides. Number one, when you're putting in these stitches, if you're not very, very careful, you can create a divot, you can create a contour deformity in the skin, okay? So it's not as smooth as it would be otherwise, potentially, okay? You have to be very, very careful when you do that. Number two, these stitches, they tend to have to be kind of either semi-permanent or permanent stitches, and then if, for whatever reason, these stitches get infected, then it becomes a real problem. Then you typically have to open everything up and remove these stitches because otherwise you can't treat the infection with just like oral or IV antibiotics. So that's a big issue there as well. So, and then this is more like a personal thing, it just takes longer, right? So I don't like to keep my patients under general anesthesia for much longer than 3, maybe 3.5 hours. So if I'm doing a mind makeover, I want to be as maximally efficient as possible. I want to get the patient up and out. And so if I'm trying to put in all these little stitches, it's going to take me significantly longer. And I think in terms of safety for my patients, I'd rather not have them under anesthesia for any longer than they need to be. So that's another reason why I don't do that.
All right, I got a question that I'm sure is a first.
Okay.
A surgery friend told me that she woke up covered in poop. Is colon cleaning prior to surgery something you'd recommend?
So we do occasionally get what we call code brown. And code brown is very, very unfortunate, but sometimes it happens. Once the patients, they're not fully conscious or waking up from anesthesia, and sometimes sometimes that just happens. So, do you have to prepare beforehand? I mean, we're not telling all our patients to do so, but of course, it's best, like, if you gotta go, definitely try to go beforehand, so that doesn't happen to you. Because, I mean, other than it being like really, really embarrassing, it also, I mean, in the serious side of it, it can potentially increase infection rates. Okay, so our stool has a whole bunch of bad bacteria, and that can cause problems. So, no, we don't ask all our patients to do like a colon cleanse, but certainly make sure you're not constipated. Make sure that you go before surgery, and so that won't happen to you.
Thank you. And after a breast aug with you, how long do you have to wear the bra?
So the surgical bra that we give you, you only have to wear that for about a week, and then after that you can switch to a sports bra. That's the easiest. So a sports bra that opens and closes in the front, okay? That's going to be the easiest for you. Just make sure there's no underwires. And you're going to be using that sports bra up until week 6, okay? And then after week 6, then you can use whatever bra you want.
Thank you. If I get a BBL in another state and surgeons are not using the ultrasound like you, what can they do to keep BBL risks down?
Well, that's going to have to be then based on their experience. So what I would urge you to do is to make sure that you truly research the surgeon and that you know that they've done a lot of these, right? You don't want to go to the newbie surgeon who's doing a BBL, some of their first BBLs, and the end is not using the ultrasound, okay? In order to do this without the ultrasound, you have to develop what we call the feel. And by the feel is that you can actually feel where that cannula is, because when the cannula is in the fat, in that subcutaneous space, which is a safe space between the muscle and the skin, it has a certain feel. And when you get into or deep to the muscle, it feels differently. It feels almost like you're in an empty space, okay? So that's what they're going to have to develop. They're going to have to develop that feel so that they know where they are. And then what other things can they do to be safe? They can use different entry points, right? So if you're using the entry point, here, let me draw that. There are some entry points that are safer than others, okay? If you're not using the ultrasound. If you're using the ultrasound, they're all equally safe because you have imaging, right? But if this is the buttock, okay? The safest entry point is going to be the one here, okay? So if they're only using that entry point, it is tough to get into deep into or deep to the muscle, okay? Because you have the bones here, you have your sacrum, and so they don't really allow the cannula to really kind of bend down. I mean, you really have to be like trying hard to do that if you're going from that entry point. So one thing that I could recommend if you're not using ultrasound is, use this entry point here, which is the safest one. The least safe ones are that if you're not using the ultrasound are the ones that are down here, okay? Because if your angle is too low, you can get directly under the muscle there and potentially injure these vessels, okay? However, I use these because I do use the ultrasound. I make sure exactly where I'm at because these are much better in terms of contouring the buttock and hips, right? From up here, it's extremely difficult to contour those hips. So if you have hip dips, it's very, very tough to help that from up there, okay? And it's a lot easier to do it from down here. Because typically what we're filling is this area here, all right? So that we can create more of that upside down heart shape, which is the signature heart shape that we have here, okay? So that's another thing that they can do. And of course they gotta maintain all other safety protocols, make sure that your BMI is okay, that your labs are okay, that you have your medical clearance, and that all these things that you're prepared and optimized for surgery.
All right, one more question. I know you have to go.
Yeah.
So, Doc, I'm very pleased to say that I had successful breast lift surgery with you 2 weeks ago, and my breasts look amazing.
Awesome. All right.
The quick question is if I have 3 months supply of scar treatment for my scars.
Okay.
And I was recently told by a friend that your scars can heal for up to a year or longer. Should I get scar treatment for longer than 3 months?
Yeah, so actually your friend is correct. So the lifetime for a scar to mature is 12 months. Okay, so it takes 12 months for a scar to fully mature. So starting at 2 weeks after surgery, you can start using the scar creams. The one that we use here is called Silogen, but basically a silicone-based scar cream is what we recommend. Okay, and certainly you can use it for 3 months, and the first 3 months are the most important. Okay, but if you have the budget, basically, because some of these creams can get a little bit expensive, but if you have the budget, then certainly you should continue to use them up to 12 months post-surgery. Okay. Now, if you don't have the budget, I would say use something like Silogen for the first 3 months, the way that you have, and then you can switch over to some cheaper options such as vitamin E oil or cocoa butter moisturizing lotion. Okay.
Thank you.
All right, we're good.
We're good.
All right, so we do have a special announcement. All right, we do have a special announcement. So as many of you know, we've been doing these WAGs, ultrasound guided gluteal fat transfer training courses, and they've turned out really, really well. We've trained multiple surgeons now, both in Florida and outside of Florida, which has been great. And we're super excited about it, and just kind of in celebration of that, we decided just to go ahead and celebrate it by giving something back to you, to our patients. So we have a promo that's about to come out, and I'm not going to give you the details, but I want you guys to stay tuned, okay? So go ahead, you follow up with us here on Pure's Instagram, right? So at Pure Plastic Surgery, you're going to see that, and then of course we'll put on on my IG as well.
Mm-hmm.
All right, everybody. So stay tuned. October promo coming up. All right. All right, everybody, it's been great. I hope you learned a lot about hydration today, and I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. Ciao.